Hi, my name is Kasey Elliott, and I'm doing my presentation today for SIDS. SIDS is Sudden Infant Death Syndrome. I am currently 33 weeks pregnant, and I'm having a baby boy who is due in April. I have a friend who recently lost her baby due to SIDS about a month ago, so I know firsthand how awful this can be, not only to the family and the family members and the friends of the family, but also how quickly this tragic death can happen to anyone's baby, including your own. SIDS is an unexpected death of a baby younger than 1 year of age. SIDS normally happens when a baby stops breathing due to having congestion, either being laid on their belly, which applies extra pressure to their lungs, and autopsies have recently shown babies born with brain abnormalities have a higher risk of contracting SIDS. SIDS is rare in the first month of life, but peaks again in the 2 to 4 month range. 90% of babies that die of SIDS are at or under 6 months of age. Out of every 100,000 live births of white babies, 90 of them will die from SIDS. Now that you know some information about what causes SIDS, let's take a look at some ways to reduce your baby's chance of getting SIDS. First off, do not put your baby face down on the carpet. Researchers have shown that they use formaldehyde used to cure carpets, which is also used to embalm bodies. So you do not want your baby sucking all of that back into their lungs. Do not lay your babies down on soft things face down, such as blankets, puffy couches, or pillows, because every bit of that CO2 that they breathe out of their mouth, they breathe back in being face down on the carpet or blankets. Laying the baby face down on their lungs stresses their lungs and their airways and forces their brains to freak out and forget to breathe. Give your babies pacifiers, researchers have said. Some moms do not believe in pacifiers because it is harder for them to break later on in life. It increases their urge to suck, and if they're sucking, then they're breathing in and out. Also, keep your baby on their back when they're sleeping as much as possible. You can roll up blankets and place on each side of the baby, and also keep their head propped up, so it keeps their lungs and air passages open and keeps them from rolling onto their bellies, which can cause suffocation. Given info about how to reduce your risk of SIDS, let's show you some facts and statistics about it. In 2001, there were recorded 55 deaths out of 100,000 live births due to SIDS. There is a higher chance risk for women having colored babies to die of SIDS than a white baby born. In every 100,000 live births of colored babies, 190 of them will die, compared to only 90 out of 100,000 white babies will die. There is no prevention for SIDS, no medicine, no symptoms, nothing to watch, nothing your doctor can tell you about will help you take precautions to keep your baby alive. It is not yours or anyone else's fault when your baby dies of SIDS. Most important thing to remember, it is not your fault. Do not blame yourself, another family member, a friend, or a doctor. There is nothing you could have done to prevent this. Many communities have developed support classes and groups to help mourning family members and parents to attend to lessen losing the agony of a child due to SIDS. In conclusion, any baby can die, no matter the parenting skills, no matter cautions taken, no matter how many times a doctor has told you to do this or that, no matter how many videos you have watched. Extra precaution can be taken, but there's absolutely no prevention for it. Doctors have concluded that taking these precautions and using safe sleeping methods can reduce your risk of your baby having SIDS. Also, having your baby sleep on their sides with their heads propped up away from the blanket or crib can reduce their prevention of suffocation. Do not put stuffed animals in the beds with the babies, toys, blankets, etc. in the sleeping areas with the babies, because they could place it in their mouth or roll over and block their airways, which causes suffocation. In conclusion, do not place your baby face down, which can cause suffocation, which is the main cause of SIDS, and there is nothing you can do to prevent the death of your baby due to SIDS.